Are you okay now? Almost in pain? Okay, later we'll see doctor, okay?
Morning, I'm your medical officer for today. So what brings you in?
I'm a doctor, and she complained that she feels dizzy since last night, and just now she feels pain on her chest, and she feels like it's very difficult to breathe since due to the pain.
Okay, so Madam Ann, can you tell me where it hurts?
Here, it gets worse when I lay down.
Okay, so I will check your blood pressure first, yeah? So, your pulse is elevated and your blood pressure is slightly low. I would like to know if she had a fever or been unwell recently.
My mother actually just had her coronary artery bypass surgery 3 weeks ago, and then she actually followed the advice by doctor that reduce her physical activities, and she's been lying on the bed since then. But other than the conditions that I said just now, she didn't complain for any other symptoms actually.
Okay, so this could be a few things. We will need imaging for further investigation. So you wait outside first. Later, we will give you a form and you will need to go to radiology department.
Oh, okay. Thank you, doctor.
Chest X-ray or echo? Or straight away CT? Hello, morning. I'm Dr. Dia from emergency department. I need to refer a case, but may I know who is speaking there?
This is Dr. FITRIYANA.
Okay, so Dr. Fitriana, this patient is 55 years old female lady. She presents with chest pain, fatigue, and shortness of breath. She also had done the coronary artery bypass 3 weeks ago, and her vitals are off as her blood pressure is slightly low. So I'm debating whether I should start with chest X-ray or do an echo or straight away get a CT scan. May I know which one do you suggest?
Okay, so I think you should start with chest X-ray first. It's quite non-invasive, it's quick, and it's also give us quite a lot of information. So from the chest, we can rule out pericardial effusion or cardiomegaly, or even some pulmonary causes, especially because she has shortness of breath, right? So if the cardiac silhouette is enlarged from the chest X-ray, we can it could suggest pericardial effusion or cardiomegaly. So then echo would be the next step if the findings from the chest X-ray suggest any fluid accumulation.
Agreed. The symptoms overlap with some pulmonary conditions too. I request a chest X-ray first and then proceed with based on the findings.
Alright, okay, good. Make sure you take both PA and lateral views, okay, for the best assessment.
Okay, doctor, thank you.
Okay.
Madam Ann, please come in. At the radiology department, the radiographer calls the patient name into the X-ray room. Before performing the procedure, the radiographer greets and confirms the patient's name and ID number. She also asks the patient's last menstrual period to make sure that she is not pregnant. Next, the radiographer asks the patient to remove her clothes, including the bra and any metal accessories such as necklace and piercings, and change into a hospital gown.
Is she wearing a bra? Yeah. Sports bra or normal bra?
Oh, no.
Normal bra. Okay, so yes, I need you to help her change her bra and metal accessories.
While waiting for the patient to get ready, the radiographer inserts a 14 x 17 inches size cassette into the bucky that is placed crosswise and centers the X-ray tube to the image receptor.
Madam Ann, are you done?
Once the patient is ready, the radiographer asks if she could stand up during the procedure. The guardian is asked to wait outside of the X-ray room.
For a few minutes.
你可以站着吗？站着一下子罢了。
Can you outside this picture? I'll do the chest X-ray now.
Now, the radiographer helped the patient to stand up and instructed her to stand near the bucket. The radiographer then gave her a radiation protection, which is a leg gun. The patient is positioned facing the detector for the PA view. The patient's chin is tucked on top of the bucket and her arms is placed at the back. The radiographer rolled the patient's shoulder forward to ensure that the scapula is out of the lung field. Next, the radiographer adjusts the central ray to the T7 and adjusts the collimator light to include the lung field. Now, the radiographer puts an anatomical marker at the bucky and explains to the patient about the breathing instruction. The radiographer then sets the exposure factor at the control panel. After that, the radiographer asks the patient to breathe in and hold her breath before taking the image. The patient is then asked to breathe normally. The radiographer proceeds to do the second projection, which is the lateral chest. The patient is positioned with her left lateral side near the bucky and her arms above head. The radiographer adjusts the central ray to the T7 and the collimator light to include lung field. The radiographer put the anatomical marker and adjusts the exposure factor at the control panel. The patient is asked to breathe in and hold her breath before taking the image. Next, the patient is asked to breathe normally.
Alright, Rita. Can put your hands. Okay. Your button will see on you. Okay.
Hello, this is Dr. FITRIYANA. Can I speak to Dr. Dia from ED?
Yes, I'm Dr. Dia here.
Okay, so just now I have reviewed the patient's chest X-ray for the patient just now. So I can see that there's an enlarged cardiac silhouette. It almost looks like a water bottle shape, and there's also clear blunting of the corsophrenic angles as well. So this is a very classic sign of pericardial effusion.
So, doctor, the next step is to confirm with echo, right?
Yeah, exactly. So chest X-ray is a good initial screening tool, but echo will allow us to quantify the effusion and assess for any signs of cardiac tamponade. If we suspect anything suspicious like possible masses, fluid, or any lung pathology in the echo, we can consider CT.
Would a CT scan be helpful in this case?
Again, the X-ray looks like a classic sign of pericardial effusion, but if the findings of the echo necessitates, then yes, a CT with contrast can provide detailed information about the pericardium, possible masses, or any pulmonary abnormalities.
Understood. I'll arrange for an urgent echocardiogram, and depending on the findings, we can proceed with a CT scan if indicated.
Okay, sounds like a good plan. Keep me updated on the patient's progress, okay?
Okay, doctor, thank you.
Alright.